Good morning. Welcome back to the Retirement Report. I'm Hank Parrott, your host. All right, I've been trying to cover a lot for you today, so I've been talking kind of fast, so I hope you're following along. This is one of the things, again, when you come into the office to see me with new clients, I cover a lot of these things, and we go into more detail with regard to your specific situation and helping you make these choices. But hopefully this is kind of giving you, some information that you understand now how these things work and how important these decisions are going to be. So cost of Medicare premiums is one of those. All right, one of the things that we get into is we talked about, right, Part A, there's no premium costs. Again, you have deductibles and copay, but there's no premium at least to pay. Medicare Part B, now this is one of those, again, on the screen it'll show you at about 105. That's what it was in 2015. In 2016 it went up to 121, and in 2017, this year, it's at 134. Not sure yet next year if it's going to stay the same or if it's going to increase, but it's $134 a month for those that are, and then once you're there, it should, that's your cost. So at 134, so that out-of-pocket cost is more like about $1,600 annually. All right, Medicare Part D, that number can vary according to the insurance that you're getting that Medicare Part D through the insurance company. So we'll stay with that number, and then that can vary a little bit, and we'll talk about other ways that you can cover prescriptions through Advantage plans as well. So there's $500. Then you've got your Medicare, for Plan F is one of the most common or one of the most popular Medigap plans or Medicare supplement plans, and there again, a monthly cost. This can vary again according to insurance. It might be lower, it could be a little higher, but let's just say that at $2,000. So if you look at the total cost, and then again add in for the increase, you've actually got about oh gosh, let's see, so it's over $8,000 for a couple per year, $4,000 each, so about over $8,000 when you showing the difference in Medicare Part B premiums. Think about that, $8,000 a year in costs. Have you planned for that? Have you, did you realize it was going to be that high? And in some instances, it could, this again is just for, here we're just counting the premiums. Okay, this isn't counting the other out-of-pocket costs. Remember those deductibles and copays that are not covered, in particular when it comes to prescriptions that are not covered by your supplement plan. So you're still going to have additional out-of-pocket costs to this $8,000. That's why we're talking about, it could be, depending on prescription cost coverage, you could be looking at, anywhere from $12,000 to as much as maybe $20,000 a year for a couple to cover your health care costs alone. All right, so if we look, well, this is one of the things too, again, I'm going to throw this out there. For the first 10 callers, these are some of the things we get into, and helping you make decisions about these is understanding the difference in how these plans work, and helping you determine which plan might be the best one for you. In addition to all the other things, right? The investment analysis, the determining whether you're going to run out of money in your, in retirement based on what you're currently doing. We look at your expenses, your income now in before retirement, or if you're already retired, what your income is, what your expenses are. What your, what if any assets and, what if any liabilities, any debt or anything, and of course then your assets and what they can bring into you. And we talk about tax planning, how to minimize taxes. It's not just what you make, it's what you keep, right? We got to keep the tax man and minimize those. We don't want to pay any more than we have to, and there are definitely strategies we can employ for that. All of that's part of the free retirement income analysis for the first 10 callers to my office, 615-376-5325. Tess is standing by. She'll get your information. She'll send you out a little packet, including a checklist of things to bring to your appointment so we can do this planning for you. It's the things we'll need to be able to do that, and we're going to do it. And by the way, if it takes 1 visit, 2 visits, whatever it takes, I want to get you a plan that you can use in your hands that'll help you and give you the peace of mind of knowing there's a way to make this work, okay? There's always a way to make it work, and having a plan, we can employ the strategies, and the sooner you start, the better in terms of getting this done, right? More options, the better off this planning is going to be. All right, so there you go. First 10 callers, 615-376-5325. Tess is standing by to take your call, and when you come in to see me, I'll give you a free copy of my book, 7 Steps to Financial Freedom in Retirement. And in that book, I break out these very things that I talk about, each week with you. This This is, you know, dealing with how we happen. You know, gives you a little historical perspective in the introduction of how we, what the way things were for our parents and grandparents and how they are today. It talks about the very things I've been talking about, gathering your information to get that foundational plan down, how to get your assets working for you to make sure that you're getting the most out of your money, that your money's working as hard for you as you work for it, right? We get into tax planning. We talk about IRA mastery, how to, when you start taking money out of those retirement plans, how to get the most out of them and with the least amount of tax. And we talk about, let's see, in there, chapter 4 is on safe money alternatives, how to, you know, how the fixed income side works and how you can, again, get more money and reduce your risk at the same time. How the smart money invests is about asset allocation and investing. That's in chapter 5. Chapter 6 about long-term care, and chapter 7 about estate planning. So it's all covered in there, and it's all part of what we do when we do planning with our clients as well. All right, we're going to get back into it with understanding Medicare. One of the things now, option 2, and this is Medicare Part C. This is one that a lot of people don't understand or don't know much about, Medicare Advantage plans. This is offered by private insurance companies like Blue Cross and Health Springs and Cigna, all right, to replace the original Medicare and secondary insurance. So you don't need a Medicare supplement plan here. So now here's where you get into HMOs or PPOs, preferred provider organizations. So one of the biggest differences with original Medicare, you can go to any doctor that accepts Medicare. With Medicare Advantage plans, you're limited to this PPO. Now, I got to tell you, I have a company plan through my work, and my company plan through my company that I provide to myself and my employees. What that does is it is a PPO as well. It's through Blue Cross Blue Shield. I've had it for probably, I've been using PPO plans now for 15 or more years. Reason, because it's less expensive, okay? And I found that the PPOs don't limit me. I can go to any of the hospitals that I would normally go to. I can see any of the doctors that I would normally see. Now, with Medicare Advantage plans, you can see and make sure in that plan that all your doctors, of course, are going to be available to you. And they look at where your location is. They look at prescriptions. There's a lot of ways that they put that together. All right. Most of these plans are going to include Part D. So they're going to have prescriptions included. They also will cover things that such as hearing and dental and vision. You can find those coverages in Medicare Advantage plans, which are not in original Medicare. Costs can increase for out-of-pocket or out-of-network doctors, so we want to make sure, again, that we've got the right network. And again, with that, you get, if you're enrolled in Part A and B, it's all inclusive in this one. And they're going to ask you about when you go on to Medicare.gov, they can walk you through these things. And when you come in, I go over some of the differences there and what that cost savings can be. And you can pick up additional things like prescription costs. As I mentioned, Medicare supplements don't cover, but Medicare Advantage plans, many of them will have additional coverage for prescriptions as well. So they can be very attractive in reducing your costs. Now, applying for Medicare is one of the things on the next slide. Enrollment's automatic if you get Social Security or Railroad retirement benefits prior to Medicare eligibility. So if, in other words, if you're taking Social Security prior to age 65, then it's automatic. But if you, and in terms of what, you know, the deductions for those costs coming out of your Social Security is one of the things that most people do as well for your premiums. Otherwise, you got to apply. And if you're still working, and this is one of the things, there's understanding this 7-month initial enrollment period. I want to talk about that briefly because this is real important. You have the 3 months prior to your 65th birthday, the month of your 65th birthday, and 3 months after your 60th. So you got that 7-month window to apply, and it's real important that if you're not working, if you don't have health insurance, and even if you are, you should still apply. You still need to get Part A, and you still need to let them know when you apply that you're working and you have health insurance coverage, and therefore you'll be able to pass on taking Part B. In other words, you do not have to sign up for Part B and pay that $134 a month for that coverage if you've already got health care coverage. All right, and there won't be a penalty. And that's the other part. If you don't sign up within that window and you don't have other coverage and you don't sign up for Part B, in other words, and you sign up later, then they increase the cost of the Part B to you permanently as a penalty. Based on the longer you wait, the bigger the penalty, of course. So you don't want to do that. Make sure you enroll when you're supposed to. And again, if you're working, you don't have to sign up for Part B, but understand, here's another piece. As soon as you stop working, okay, you don't wait till the next year. As soon as you stop working, all right, if it's January of a year or November of a year, you immediately apply for Part B at that point and get signed up. So again, you don't have any penalties or anything by delaying. All right, the next piece, understanding Medicare. This is one of those things when it comes to, now that we've covered this, basically understanding there's Medicare, these are the resources available to you where you can get more information about Medicare. All right, when it comes to understanding how these costs work, the next piece is creating a plan to cover your health care costs. All right, so one of the things when it comes to planning, all right, when it comes to making these decisions, is we look at the impact. Wouldn't it be nice to see if the decisions you made today, you said, okay, I'm going to do this for my investing, or I'm going to do this with regard to Social Security, or I'm going to make this decision with regard to Medicare, and we could show you 10 years, 15 years down the road what that impact would have been on you financially. That's what planning is about. That's what we can do. And that's what I do with my clients all the time, is I show them their financial future based on the things they're doing now. When someone comes in for the first time, I say, based on things you're doing now, this is your future. If you want to improve it, here's some things you can do to accomplish that. Isn't that great? Wouldn't you like to see your financial future? Well, we're going to talk about that a little more when we return. But first, we're going to take a break. Join us here. We'll be right back on the Retirement Report.
Are you